Hello, this is Billy Williams, Medicare Health Insurance Options. Phone number is 800-499-1942. In this video, I'm going to talk about Medicare and how Medicare works in regards to treatment for cancer. If you look at the statistics in our country, 1 in 3 people have or will be diagnosed with cancer. This means that either you or someone that you know will be faced with this challenge in the near future, and how your insurance works in regards to the cost of paying for your cancer treatment, of course, is very important. How your Medicare coverage pays for your cancer treatment will depend upon what path or what option that you chose whenever your Medicare began. Option number 1 would be if you still have original Medicare as your primary coverage. This means that Part A and Part B is your Medicare main coverage. In this case, you probably also have a separate standalone Part D prescription drug plan. You also most likely have a Medigap or a Medicare supplement as your secondary. So that would be option number 1. Option number 2 would be if you had decided to get a Medicare Advantage plan. These are managed networks, either an HMO or a PPO. These plans do work differently in regards to the payment for your cancer medical treatment than as compared to option 1. So let's start with option number 1. If you have Medicare Part A and Part B of Medicare, the first thing to understand that Medicare Part A will cover you if you are in need of being admitted to the hospital, and it's certainly very possible that at some point in your treatment you are going to be admitted to the hospital. If you have Medicare Part A, then you do have to pay what's called your Part A deductible. In the year 2020, the Part A deductible is $1,408. If you receive any medical care that's not a hospital stay, then that is going to be covered under Part B of Medicare. Part B of Medicare does require you to pay in the year 2020 a $198 deductible. Once this Part B deductible is paid, then Medicare Part B will pay 20% from that point for all of your non-hospital stay medical care. Therefore, if you need any medical care for your treatment of cancer that is not a hospital stay, you will be responsible for the Part B deductible, and then you will also be responsible for the 20% copayment. So in this scenario, it is very much in your best interest if you have a Medicare supplement policy. Your Medicare supplement policy will pay your Part A deductible, and depending on what plan letter that you have, it may pay the Part B deductible. It will also, regardless of what plan letter that you have, it will pay for the 20% copayment. This is most important when we're talking about the cost of medications. If you are receiving chemotherapy treatments, radiation treatments, some other non-self-administered treatment, injections, infusions, these will all be covered under Part B of Medicare. And if you have a Medicare supplement policy, your secondary plan will pay for the 20% copayment. So if you have Medicare Part A and Part B as your main primary coverage, and you do have a Medicare supplement policy, the majority of your healthcare costs are going to be taken care of. Your exposure, your maximum out-of-pocket will be relatively minimal, which is good news. Now let's talk about option number 2. If you decided or are thinking of enrolling in a Medicare Advantage plan, it's important to understand that these plans work very differently when it comes to the cost of treatment for your cancer treatment. On a Medicare Advantage plan, each time you receive care, whether it be a visit to your doctor, some type of a testing or screening, a hospital stay, if you need chemotherapy or radiation or any other type of procedures, you are going to have some type of either a flat fee, which would be a copayment, or you're going to pay a percentage of the cost of that treatment. The most important or the most expensive thing that you're going to occur is treatment for chemotherapy and radiation. You're going to pay on most of the Medicare Advantage plans 20% of that cost, which is definitely going to add up. Now, your Medicare Advantage plans do have a maximum annual out-of-pocket. What this means is that when you are receiving different types of treatment for cancer, you will start paying your cost-sharing payments, and those will add up over time. Once the total of your payments reach a certain amount each year, then you will reach your maximum out-of-pocket and you will not have to pay any more. However, the maximum out-of-pocket on most Medicare Advantage plans is relatively high, somewhere in the $6,000 or above range. The other thing to understand is that if your cancer treatment happens to occur over 2 separate calendar years, let's say, for example, you are diagnosed with cancer in, let's say, the fall of one year, and you begin your treatment, and you do meet your maximum out-of-pocket in that year. However, if your treatment continues into the next year, that maximum out-of-pocket is going to reset. So it's actually possible, if you are on a Medicare Advantage plan and you are being treated for cancer, that you might have to pay your maximum out-of-pocket more than once. Now, this is a worst-case scenario, but it certainly is something that can happen. Therefore, if you are considering getting a Medicare supplement policy or you're getting a Medicare Advantage plan, taking into consideration what your maximum out-of-pocket is going to be for the treatment of cancer can be a very important factor to consider. I hope that this information has been helpful. I know the decisions that you need to make in regards to your health insurance coverage is very important. We would like to speak with you if we can help you in any way to help you through this decision process. Again, my name is Billy Williams. My website is MedicareHealthInsuranceOptions.com. My phone number is 800-499-1942. My services to you are always free, and if we can help in any way, we certainly be happy to. We do look forward to talking to you in the near future. I hope you are having a great day. Thank you.